An ounce of prevention is worth a pound of cure, or so it's said. And as the world stares down a pandemic, governments confront tough questions about how to prevent the spread of the new coronavirus. Here to explain the powers available to the powers that be here in Ontario, we welcome Dr. Eileen de Villa. She is Medical Officer of Health for the City of Toronto. Stephen Hoffman, Director of the Global Strategy Lab and Professor of Global Health, Law and Political Science at York University. And Ryan Watkins, employment lawyer and a partner with the firm Witten and Lublin. Good to have everybody here with us tonight. And Medical Officer of Health, I want to start with you right away. What is public health doing right now to stop the spread of COVID-19?
Well, we've been doing quite a bit, as you know, over the last several weeks. Certainly, monitoring the situation globally has been one of our key elements to the response. But, you know, we're at a phase right now in the country where the focus is still on containment as much as possible. We know what's going on. We've had the opportunity to observe what's happening in other jurisdictions. Hence, we're actively engaged in surveillance and monitoring, but also very assertive case and contact tracing. So every time we find a case, we are on it and absolutely following up on their circumstances, understanding how they got the disease, and then following up assertively with everybody who is identified as a close contact of that case.
Can I just do a follow-up on three different terms that we hear all the time, and you'll tell us the distinction here. Isolation, quarantine, social distancing. What's the difference?
So isolation, we're talking about people self-isolating, staying at home to try to prevent spread. Quarantine is a different sort of issue. Quarantine is something where we're talking about somebody who doesn't actually have the disease, and we're trying to prevent further infiltration, if you will, of the disease into a community.
And that's sort of an order. Quarantine is an order?
It is. It is. It's a very age-old practice from a very, very long time ago as a method of prevention of introduction of infectious disease into a community. But it is around preventing those and preventing transmission and isolating those who don't actually have illness.
Social distancing?
Social distancing is actually trying to create spaces so as to limit the possibility for transmission. So we know that when we have diseases such as COVID-19 that actually require close contact with the respiratory droplets and secretions of a sick individual, to close contact with those respiratory secretions, the best thing that we can do, or certainly one of the effective measures, is to separate people such that any transmission is less likely to occur.
Gotcha. Stephen, let me bring you into this. There are many different authorities in this country that have many different powers to be right now. Local municipalities have powers, the province has powers, the federal government has powers. Figure it all out for us. Who's got what?
Well, in the context of a public health event or emergency like this one, we do have legal authorities, and there's quite a lot of powers that are vested within our chief medical officers and our ministers and leaders. What's important is in public health is ultimately local. So it means that it's really the local public health units. It's really people like Dr. de Villa who are leading the charge and really are the public health heroes right now. She and her colleagues across the province have powers to order people into isolation if they have the virus or if there's a clear sense that they have something like it. They also have a variety of other orders, like the ability to order sanitation of a site, as well as to gear up and call on a whole bunch of other resources as they need. But of course, as we know, cities and local units and regional public health units are actually creatures of the province. And in our constitution in Canada, it's very clear that healthcare is within the realm of the provincial government. So a lot of the authorities are then created at that level because that's where a lot of what will happen when people are sick and interfacing with the healthcare system, it's really at the provincial level. But in the context of public health, which is broader than healthcare, it actually is a shared responsibility under our constitution, shared between provinces and the federal government. And so in that respect, when we think of the kind of powers that different actors have, it's very much dependent on legislation that's been created by our parliament as well as our provincial parliament here in Toronto. The one place where the federal government has the sole discretion and sole authorities is around what happens at the border. So there's a lot of talk in the news media right now about people coming in and out. That is federal government jurisdiction, and that's where the Quarantine Act comes into play.
Okay, just to be clear then again, the feds can shut down the borders, But she can shut down the city? And Christine Elliott can shut down the province?
Well, I wouldn't say shut down. So, all powers need to be exercised in a way that minimally impairs the rights of Canadians, and that's proportionate to the risk that's involved. So the exact circumstances under which, for example, a local chief medical officer or the provincial chief medical officer of health would have these authorities would be prescribed in the legislation, but all of those powers are subject to limits that are described in the Canadian Charter of Rights and Freedoms. And when it comes to public health, quite a bit of the things we might ask of people do actually infringe on rights, right? Like the right to liberty. So quarantine is essentially asking people to not engage with the rest of their community for the benefit of everyone, but it's limiting their right to liberty. But that's okay, even under the Canadian Charter of Rights.
Reasonable infringement on their rights.
But it only is okay if it's reasonable, if it's proportionate to the risk involved, and if we do it in a way that minimally impairs that right.
Just
That's
quick follow-up with you. Have you had meetings with provincial and federal officials so that everybody knows who's got what authority to do what, and you're all on the same page?
Yes, and
You've discussed this.
Absolutely, and this is a regular conversation that we have. Again, remember, infectious disease management isn't just in the context of global outbreaks. It happens on a daily basis, right? We have infectious diseases that circulate within human populations at all times. So, we're in regular conversation, absolutely, on this one. But this is a conversation that's ongoing all year long in respect of several infectious diseases.
Okay, that's the story around governments. We've got you here today because we want to understand better what's going on in the private sector. Companies, employers, what are you hearing out there right now in terms of what they are doing and can do vis-a-vis their employees?
Well, I think there are certain steps that employers can take to do more to assist. In the workplace, that's the place where we see a lot of people congregating together. So it's important to ensure that public safety is paramount. So I would suggest that employers continue to update their policies with respect to things like travel, business travel. We want to ensure that places that have been affected, we're limiting travel to those areas.
Well, can I get specific there? If you're a business that's doing business in Italy right now, are you basically telling the company, no one's going anywhere near this country right now?
Absolutely, right? So they're under quarantine, and so a part of the process is to ensure that we don't have others being affected here in Canada. So restricting business travel to for example, Italy would be something that would be something that employers should indeed look at. In addition to that, I think employers should also want to update sick policies, right? We want to communicate to employees that if you are sick, report that to us. Don't come into work. Ensure that you go into self-quarantine if you've been affected or a family member has been affected by the virus.
Well, again, I want to follow up on this because we did a program about this recently. Sheldon, travel with me, if you will, to the bottom of page 4. We're going to go a little bit ahead here, but since Ryan brought this up, we did have a discussion here about sick days and the fact that a lot of people in this province don't get paid if they don't go to work. And if they take a sick day, they're taking dock and pay. Had a bit of a conversation about that. Let's roll that clip, and then we'll come back and chat. Thanks.
We know that workplace spread is a major contributor, and it's important that people can stay home from the first day of their illness. When people don't have access to paid sick leave, or when they only have 3 days of job-protected emergency leave, people parse those days out. They tell us all the time. They kind of do the math, right? You go to work the first day, and then the second day and you get sicker, and then the third day, maybe now you're really too sick, and then you're gonna stay home. You've already infected other people in your workplace. We need a policy that protects people in a much more comprehensive way than that.
So Dr. Heyman's point, obviously, is that it's time for the provincial government to reinstate paid sick days, which they took away when they took over the government of Ontario. What's your view on that?
Absolutely. In times of crisis, that's something that should be considered.
Considered or done?
Absolutely. I think in this case, done.
How many?
The previous government had 10 sick days. Of that, some of them were paid and some of them were unpaid. I think this is something where potentially the federal government should step in. We have sick leave days where you can apply for medical EI. Under that, you can get up to 15 weeks of medical EI. That could be an area where the federal government could step in as a safety net to ensure that employees who have to be self-quarantined or who are sick are adequately compensated.
Okay, one more, Ryan, for you, and that is if you work for a company that wants you to take a business trip to some place that nobody's going to send anybody to Italy right now, but let's say someplace that, I don't know, just makes you nervous. Are you allowed to say no?
So under the Occupational Health and Safety Act, employees are allowed to restrict or inform their employers that they are not going to do anything that is detrimental to their health. Now, that standard is a sliding scale, and what could be detrimental for one employee may not be to the other. So I would say, it has to be surrounded by reasonableness. So if there's a situation where you're genuinely fearful of traveling to a different country and that fear is real for a specific reason, then an employee can absolutely tell their employer that I'm simply not going to travel there. What's also important to note, though, is that we have to look behind the reason of why the employee may not want to travel. So there's a fine line between saying, I'm fearful and also discrimination, right? So we don't want to be a society that discriminates against a certain segment of the population. So for example, if we're talking about traveling just on the basis of, that ethnicity or that race I don't want to be around, well, then we're in chartered territories of human rights discrimination against a specific race or origin. And so we don't want to do that because there could be violation of human rights.
Understood. Let's, okay, Sheldon, back onto page 2 here at the top, and let's bring this map up right now. And I will describe this in some detail for those listening on podcast right now and can't see the map, but we're looking at a map of the world. And the more darkly shaded red areas, not surprisingly, China, Italy, parts of Western Europe, interestingly enough, the United States. Those are the areas where this is particularly problematic, the COVID-19 cases. And there are parts of the world which are completely fine, apparently, at the moment. There are lots of countries in Africa, some parts of Central Asia, some parts of northern South America, where there have been no cases at all so far.
Let's look at the map and look at those gray countries, the ones without the red. So they apparently have no confirmed cases of COVID-19. There are many nations in this world that frankly don't have the resources and don't have the healthcare capacity, the public health system in order to effectively detect COVID-19. It does take a well-developed system, a well-developed public health system, a well-developed testing system, a laboratory testing system, in order to actually identify these cases. And the unfortunate situation is for many nations around the world, this is just not the case. They do not have those resources available.
So no point in calling it then if they can't do anything about it?
Well, no, the issue is that just because they don't appear to have COVID-19 cases doesn't mean that they don't have COVID-19 cases. You actually have to look for them and be finding them in order to declare that you have them. So one does have to take all this with a little bit of a grain of salt. So even for those countries that do have the capacity to test, the frequency and the amount of testing will determine how many cases you're actually identifying. So I think, again, as with any situation, it's all in the context, and you have to look a little bit deeper than just what you see on the surface.
Gotcha.
In addition to the capacity issues, there's also the question of incentives. If there are many countries, as Dr. de Villa mentioned, that don't have much capacity, and if they are to identify cases, and if their healthcare system is not able to respond to them, those countries might be legitimately asking themselves, why should we be looking for cases? Especially when there have been many other countries, dozens of countries around the world, that have imposed travel restrictions and travel bans against countries that are starting to report cases. It really highlights that decision that many governments, fortunately not Canada, but many governments out there, when they are imposing travel restrictions, they might be doing it trying to be better be safe than sorry. But actually, those kind of travel restrictions not only undermine the public health response, but actually they disincentivize many countries in the world from looking for COVID-19. Because why report it if they're just going to get slapped with these punitary?
right.
Well, let me do a follow-up here, because we have heard many states in the United States have declared a state of emergency. What does that, I mean, other than it gets the governor on TV looking very serious about things, what does that actually do?
Well, in most contexts, the reason we see a declaration of emergency is because it then opens up additional powers available. Maybe
For
it's
whom?
well, it would be different depending on the legislation that in which that emergency declaration was made. Sometimes it's a budget. Other times it's new authorities to, for example, contain people or do different things that wouldn't usually be allowed. Still, other times it might just be for the rhetorical declaration. So, for example, the World Health Organization, there's this big question, why hasn't the World Health Organization declared this issue as a pandemic? Well, there's no legal powers that come with that declaration. There's no budget. It's really a communications tool. And the World Health Organization is saving it for the time when it feels like it needs to sort of kick the world in the butt and try to get additional reaction. The legally important term, which the World Health Organization already declared, is that this is a public health emergency of international concern. That long name, it's a legal term. It comes from the International Health Regulations, which is the treaty that governs how 195 countries around the world are supposed to be responding to this outbreak.
Dr. de Villa, if you're a Canadian watching this right now and you have plans to travel to one of the states in the United States that has declared a state of emergency, would you advise those people to cancel their trip?
Well, the advice that we're giving to people in respect of travel is first and foremost, take a look at what the Public Health Agency of Canada is providing in terms of travel advisories. That's your first place to look. There is very specific advice given around what precautions, if any, travelers need to take premised on their destination. So first and foremost that. Again, moving around, traveling to different jurisdictions, there are some very good measures that people can take to protect themselves. They're the same measures that people should be using to protect themselves right here. And I know that people are tired of hearing me say this, but washing your hands is an incredibly powerful tool to protect oneself from respiratory diseases, including COVID-19.
How many times a day?
You know what? It's not a question of the number of times a day. It's in respect of what kinds of activities you're doing.
Okay.
So before and after eating, before and after using the washroom. If you touch your face, which we know we all do several times a day, you want to make sure that you're washing your hands before you do that as much as possible. So there are many different, precautionary measures that can be taken. And of course, I would also be remiss if I didn't add, stay informed. Find out what's happening. Keep up with what's happening in the area in which you're visiting so that you understand what the context is and can manage yourself accordingly. Of course, at this stage of the game, with a constantly evolving situation, people do need to pay attention to what's happening around them and also to be conscious of the fact that there are increasing requests for people to self-isolate and to self-monitor. Especially after the return to travel.
Well,
Public Health Agency of Canada has just asked all returning travelers to Canada to carefully monitor themselves for 14 days after the return from their travel for any signs and symptoms of respiratory illness.
Can you let's do a little more on that because, let's take Massachusetts, for example, which I believe just declared a state of emergency. If you're tonight flying home from a trip to Boston, what should you do?
Again, I would say wash your hands. Absolutely, wash your hands. Cover your cough and sneeze.
Self-isolation necessary?
So what's actually being asked of returning travelers is to monitor themselves carefully for signs and symptoms of respiratory illness for a period of 14 days after their return. And should you develop those signs and symptoms of respiratory illness, those individuals are asked to self-isolate, contact their healthcare provider or their local public health department so that they can then get guided appropriately in terms of next steps.
Do you think businesses understand that this is their, if not legal obligation, then at least moral obligation?
Absolutely, or at least they should, right? So under the Occupational Health and Safety Act, employers have a duty to protect their workers. And so surrounding that, we want to ensure that if there are anybody returning from areas or hot spots, let's call it, to ensure that they take adequate steps to ensure that they can return to the workplace and not get anybody else.
You doing any traveling these days?
Me, not so much.
No?
I'm busy at work, but past that, I think it's important as civic society and people that we, try to do what we can to help contain this. And so I would say in terms of business travel, that employers and employees should really think about restricting that travel until the situation can be contained.
Well, let's do a real life example here. If for whatever reason business could possibly have to take you to New York State or Massachusetts, would you go right now?
I personally probably would not go at this time. I think anybody who has elderly parents or young children, myself, I have two young kids under the age of 4, one with some respiratory conditions. I want to ensure that I'm protecting my family, and I think others feel the same way. So if there are situations personally in somebody's life where they could be affected by this, I think we have a duty to protect others around us, especially in the workplace environment where we're dealing with colleagues.
Right. To that end, Stephen, we have something in Canada called the Quarantine Act. What does it do?
Well, the Quarantine Act gives the federal government, specifically the Minister of Health, powers to designate any site in Canada as a quarantine area. So that means an apartment building, a hospital, part of an Air Force base can be designated as a place where people can be asked to go, ordered to go, to remain so that they don't, who might be at risk of having something, but don't have it, and actually be asked to stay there to protect the community. The reason the Quarantine Act is so important is because when we ask people to go into quarantine or order them into it, that's a limitation on their right to liberty. And indeed, in the Canadian context, also the right to mobility within the country. And so what that means is if the government is going to limit that right, then that limitation needs to be prescribed by law. That's in our Canadian Charter of Rights and Freedoms. And it needs to be not only prescribed by law, but that law needs to be actually acted upon and implemented in a way that meets the standard expected in the Charter. So that means it needs to be proportionate to the risk involved, as well as minimally impairing. So for example, one really interesting question in the Canadian context is whether it would be legal for the federal government to quarantine an entire cruise ship. Let's say if it was off the coast of Halifax or Vancouver. We've seen that now in a couple of countries, Japan and the United States. And I don't think it's so clear whether that actually would be legal in the Canadian context. It might not also be legal in the American and Japanese context either, but the reason is because there's this question, if there's some risk on a cruise ship, is that risk, does it justify, is it a proportionate measure to actually quarantine the whole ship? Which actually, because we know the way cruise ships work, it actually could increase the risk of people on there. Is there not a less impairing way of those people's rights, such as by bringing them onto land and better segmenting and quarantining more effectively? Probably. At which point, if this ever did get subject to judicial review in the Canadian context, we would likely see courts deeming a huge mass quarantine of that size affecting thousands of people to be unconstitutional, unless the risk posed was deemed, based on the best available evidence, to be proportionate to the action.
But then again, as you well know, even if the courts decided that this was an unconstitutional infringement on people's rights, the federal government or the provincial legislatures could invoke the notwithstanding clause of the Constitution, override that court decision, and still go ahead with it anyway, right?
They could, but to do that, they would require legislation, right? So the notwithstanding clause is part of our Canadian Charter of Rights and Freedoms, allowing government to override certain rights, but it has to be done within legislation. So to get House of Commons, Senate, as well as provincial parliament here in Toronto to act on that and invoke it would take some time and more difficult in the context of the federal government, which is currently a minority government.
Has the Quarantine Act ever been enacted by any health minister in Canadian history?
The Quarantine Act is in effect every day. So the fact that when Canadians or others land at international airports, the fact that there's representatives from the Public Health Agency of Canada at those airports, they're essentially making use of the Quarantine Act. And so, for example, at any time for any virus, bacteria, other pathogen, if the officials believe there's a risk to Canadians, those officials, those public health officials can make use of the Quarantine Act. More recently, in COVID-19, we have seen the Quarantine Act used to designate the CFB Trenton base as a quarantine site. That, on one hand, maybe it wasn't actually needed to designate it because that land and area is already under the control of the federal government, but it was invoked in this case, and likely out of an abundance of caution approach, which makes sense.
Dr. de Villa, if, or maybe we should say when, we experience a community outbreak, who knows, if or when, you have the power to do what?
Well, under the Health Protection and Promotion Act, which is the provincial legislation under which public health in this province works, we have a number of powers at the local public health level. In respect of a communicable disease, in the circumstances where we can say that a communicable disease exists or may exist, and that it poses a risk to community members, to people within the jurisdiction that I serve, if there are actions that we can demonstrate are actually necessary in order to mitigate or reduce that risk, then we can take those actions. And as Stephen mentioned earlier, there are a variety of different forms that those actions can take. Things like requiring people with an infectious disease to isolate themselves, requiring cleanups or disinfections of certain sites, destruction of material if there's a certain substance that's felt to be the source of the infectious disease. There are, a number of different actions that can be taken, and it all depends on what the situation is.
But your office has the authority to do all of those things.
We do, as does the Chief Medical Officer of Health of the province, whose powers extend over the entire province. He also has greater powers in that he is able to procure supplies and equipment and move them around the province in order to effect an appropriate public health response. But as Stephen actually rightfully points out, it all has to be done in balance, right? There are individual rights and there are community rights, and there are measures that we take to protect public health. All these things have to be done with careful consideration and in balancing those individual rights with the community rights, making sure that what we're asking individuals or agencies or organizations to undertake as public health protective measures are actually proportionate to the risk that the disease in question presents to the community.
And one last clarification here. You are the medical officer of health for the City of Toronto, the 416.
That is correct.
So you don't have authority over Halton Region or York Region to do any of whatever you want to do?
No, they have their own medical officers of health.
Okay, so it's not Greater Toronto Area, it's just the 416.
Just the 416.
Gotcha. Let's read this. This is Jamie Watt writing in the Toronto Star a few days ago, saying the COVID-19 issue has revealed a larger problem: the epidemic of mistrust Canadians have in their public institutions. Over the past 30 years, there has been an observable decline in our collective confidence in institutions like government, big business, news media, and democracy at large. I'm actually curious, do you sense that right now?
Well, I think that there has been some degree of mistrust in science, and we've had some interesting conversations on that issue. But I can tell you that from a public health perspective, it's always about the evidence first. At the end of the day, public health practice needs to be premised on the best available scientific evidence in the realm of public health. And so it's very important that we put that out there and that we inform the public as to what our understanding of the science is and why we're making the recommendations that we make.
I don't mean to butter you up here, but everything I've heard so far from virtually all the people that I have interactions with say they're kind of confident in all of the way our institutions have responded so far. Are you hearing the contrary?
Well, I should hope that they're more than kind of confident.
Okay.
I would actually prefer to hear that they're confident in what they're hearing thus far.
I'm hedging a bit just for, journalistic reasons. I'm sure there's some people out there who are not confident, but yeah, most of what I hear is that everybody's pretty confident in what you're up to.
And I think that part of that is that, one, we have made concerted efforts as a public health sector to ensure that people understand that we premise our decisions on science And I think as well, we've tried to be very forthcoming and very transparent around that which we're doing, why we're doing it, and what stage we see ourselves in respect of managing this situation. I imagine that there will always be a certain degree of criticism. And I've also spoken a little bit about, how it's tempting, I think, to assess or judge the actions of public health or any other government institution looking at the rear view mirror. It's much easier to do that, but I would suggest to people that what we do is we take the best available information we have in front of us at the time, we act on that, and we tell people the situation is changing and it's changing quickly. So if you see us change along with the change in circumstances, that shouldn't be a surprise. That's in fact good practice.
I guess I make the distinction between the way we seem to be doing it here in Canada, where we're having medical professionals out in front of the microphones giving advice, versus the way they're doing it in the United States, where I see Donald Trump and Mike Pence out there giving advice, and obviously they're not professionals in this area. Anyway, that's my little commentary for the day. You wanted to say?
We'll leave you with your commentary.
Okay.
Well, although I can say, at least when you look globally, which is what I do in my research, I can't find another country that has handled this outbreak better than Canada. And I say that because when you look across, I know that there's a lot of emphasis on, let's make sure we don't underreact, but we need to equally make sure that we don't overreact. Because sometimes when we're seeing in many countries around the world are overreacting to this threat, the overreaction can actually cause more harm than the virus itself. For example, I'm thinking right now there's 180 million children in China who are not going to school, who are at home because of measures taken in that country. That's a lot of kids not getting education, a lot of kids whose parents have to worry about whether they can go to work, whether they can put food on the table.
Is it an overreaction?
Is what we're seeing in China, the kinds of mass quarantines and unprecedented scale of things we've never seen in public health before? Yes. And it's not only because the measures are unlikely to work, or they're also that it's not, even if they do work, and some modeling has shown that the extreme measures taken in Wuhan, the city where this originated, that maybe it delayed the spread of this virus by 3 days to the rest of China, maybe. It's just not worth the mass ordeal that Chinese people are going through right now for 3 days.
Can I do a little local example here? Boy, I could really put you on the spot with this one. Should I?
I have a feeling you may go ahead and do that anyway.
Well, I'd like to get both of you on it because it's a workplace situation. There's a Toronto City Councillor named Josh Madlow who decided that because he had contact with somebody who had COVID-19 at, somewhere along the way, that he's self-isolating. He's at home in his basement, no contact with his wife and daughter, no contact with his constituents, not going in any community events. Is that an overreaction?
So look, as a medical professional, right, I'm not going to engage in a discussion on air with respect to somebody's personal health information. But what I can tell you is from a public health perspective, those who are identified as close contacts of cases of COVID-19 are being managed through appropriate self-isolation for a period of 14 days after that close contact. We know how the disease is spread. We have an understanding, despite the fact that this is a new virus, only really identified, first came to attention of the world at the end of December, virus actually identified and sequenced in early January. So still much learning going on, I will say that. However, we've had a fair amount of experience around the world around controlling transmission. So from a public health perspective, close contacts of somebody who is a confirmed case of COVID-19 are being managed appropriately with self-isolation for a 14-day period of time.
Which is what he's going to do.
After that
Ryan, take
exposure.
the last minute here and tell me from an employee workplace standpoint, he obviously thinks he's doing a solid for his colleagues. This, out of an abundance of caution, he's asymptomatic, but out of an abundance of caution, he wants to make sure he doesn't get anybody at his workplace infected. Props to him.
Yes, I would echo the doctor's sentiments. This is exactly what we want to see in the workplace. If you have an inkling of belief that you may be infected or that somebody around you has, we want you not to come into work and to self-isolate for a period of time. And I think the last link in the step is to go see a doctor and ensure. Just self-isolating alone may not be enough. From an employer context, an employer is going to want to see a medical note from a medical professional saying that you are cleared to come back to work.
Okay.
If I could, sorry, I'm going to pick up on that one though, because if you are going to go see a healthcare professional and you actually believe you have, or you have reason to believe that you might have COVID-19, best to call that health provider in advance so that they can manage you appropriately in the healthcare setting and not create new transmission
Don't
risks.
just show up.
We also need to revisit the medical notes. It just is over. It's a practice that many employers have right now. It's just not based on good evidence. It's not good public health, and it actually can overtax an already strained healthcare system in the context of an outbreak.
We talked about that a couple of weeks ago as well. Okay, really good information tonight. Thank you very much to Stephen Hoffman from York University, Dr. Eileen de Villa from Toronto Public Health, Ryan Watkins from Whitton and Lublin. It's great to have you all on TVO tonight. Thank you very much.
Thank you.
Thank you.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.